and welcome back to the next webinar in the Sonder Youth Services webinar program for 2021. My name is Claire. I'm from the Community Engagement team here at Headspace Adelaide, and I'm joined by, do you want to introduce yourself?
Yeah, Steve Wright. I'm the Exec Manager for Youth Services at Sonder. Thanks for joining us.
And today we're having a chat about the impact of COVID-19 on young people in South Australia. First up, I'd just like to acknowledge the Aboriginal and Torres Strait Islander people as the first people of Australia, and we recognise the cultural, spiritual, physical and emotional connection to their land and pay respect to elders past, present and emerging. And I'd also like to acknowledge that the land that we're on today is the land of the Kaurna people, and I believe Ash and Shrew are also on Kaurna land today as well. So just quickly want to give you a bit of an overview about the webinar series that we've been doing here with Sonder. I'm not sure if you've engaged in some of the sessions we've been doing, but these sessions are a great way to foster learning, discussion and build cross-service collaboration. So Sonder is one of the largest providers of youth mental health services in the Adelaide metropolitan region. And we like to acknowledge our funding bodies, in particular the Adelaide Primary Health Network, in enabling us to provide these services. So the webinars are really great in allowing us to sort of come together and have that interagency connection within youth mental health sector in South Australia. And so if you're interested in any of the other topics that we have coming up, please let us know. The webinars are running still for a couple of, probably another month or so. So if you're interested in engaging, come and have a look at those. So just some housekeeping. So this is Demio, so we don't actually have any cameras turned on for these sessions, but if you have any questions, feel free to just pop them in the chat. So on your screen, you should see a chat on the right-hand side. So add them as we go and we can weave in the questions, or we might address them at the end, depending on how big the question is. So today we're joined by some of the members of the Headspace Youth Reference Group. So I'll just give a bit of context quickly about youth reference groups. So they're made up of diverse young people who have a passion for mental health and community leadership, and they volunteer their time and provide consultation and guidance in maintaining youth focus at Headspace. So we have youth reference groups at all Headspace centres, and particularly Sonder supports Headspace Adelaide, Edinburgh North, Marion and Onkaparinga. And today we're joined by two lovely youth reference group members. So would you like to introduce yourselves and share a little bit about yourselves to us?
Yeah, of course. Hi everyone, my name is Shrew. I joined the Headspace Youth Reference Group early last year. I'm with Headspace Adelaide. I am currently a second year Bachelor of Health and Medical Sciences Advanced student at the University of Adelaide. It's a long title. And I'm majoring in public health. So I've nearly finishing 2 years in that. A little bit about myself is I was born in the UK, and when I was very young, I moved to India. So I've spent most of my time growing up in India. And I moved to Australia when I was 15 years old. So I've been in Australia for about 5-6 years now. Even in Australia, I was just telling Claire and Ash before that I've moved around in Australia quite a bit as well. So I started in Sydney. I've lived in Port Macquarie, which is regional New South Wales, Perth, now Adelaide. And my family is still back in Sydney. So I came here to study and sort of kick off my independent living as a young 18, 19-year-old when I first came to Adelaide. And on the side, I do Indian classical dancing. I'm acting with an acting school in the city in Adelaide. And I love spending my time with the team at Headspace as well. So thank you for having me today.
Thank you for joining us.
Oh, hey, I'm Ash. I'm also a youth reference group member from Marion. I'm also a Marion Youth Ambassador, which we just do workshops, events. So we host little spaces. We're the sort of, I guess you could almost say, face of the volunteer side there. Yeah, I'm studying my first year Bachelor's of Psychology honours, hoping to take that into a more disability line of focus. I moved here from Queensland, rural Queensland, in 2020 at the beginning of the year. Moved here for study as there wasn't really much option out in rural Queensland, and just to be a bit closer to some people I knew here. I'm also I like getting out and adventurous, I guess you could say. I like to explore places, so haven't had much of a chance yet naturally in SA, but from what I've seen, it's a very beautiful state.
Thank you so much for joining us, Ash, as well. So today we're having a bit of a chat about the impact of COVID-19 on young people, and obviously you're both amazing young people. And so I guess we wanted to hear a little bit about how COVID-19 has impacted your life so far as a young person, and just sharing a little bit about your experience over the past year or so.
Yeah, I think with the impact of COVID when it kicked in early last year, I had just moved to Adelaide from Sydney, and I'd left my family behind, and I just moved here as a starting my study at Adelaide Uni. And when the lockdown happened, because all my study went online, I chose to go back home. I knew of many other people that had done the same. They were going back to their home, and I went back to my family, and I stayed with them for a few months. But I had chosen to live at student accommodation, and at the time, it was expensive. I was paying $350 a week for my student accommodation, and I wasn't actually using the space. I'd gone back home, and for a good 4 months, I was paying for a place that I wasn't staying in, and it used up a lot of my savings. It used up a lot of the money that I had built up by then. So I think in a way it did put this element of financial pressure on me. And at the time, I didn't really know anyone very well. I didn't really know whom to open up to. So I think it did build up that pressure, financial pressure on me, which I now know that many others went through at the time. And that means when I came back to Adelaide, because I lost some of my savings in that, I was working 2 or 3 jobs at the same time for a good 8 months, 9 months, so all the way from mid last year till early this year. And I was just saying that my family is very supportive. They never said to me that, they've always been there for me when I've needed them financially or physically, emotionally as well. But I felt this pressure to recover what I had lost. I felt this pressure to build my life. That's why I'd come to Adelaide. So I think I was working 2 or 3 jobs, and it was a bit of a stressful time. I still look back at it and I don't know how I managed. When I look at my calendar back to last year, it was I was running around quite a lot. It feels much better now, but I think that was a stressful time. Even socially, I don't know many people because I just moved to Adelaide. I didn't know anyone. I wasn't sharing house with anyone. I was living in a little studio apartment of my own, so I didn't get out much socially. So yeah, it was an unpredictable time.
Yeah, it definitely sounds like it was an unpredictable time. And I think
Yeah.
the financial stresses that you've mentioned is something that young people have faced during that time and are still facing in regards to, it's supposed to be a time where you, I don't know, sometimes work jobs and start those savings and start establishing a life for yourself. And the impact that COVID's had on that is quite large, I think. What about yourself, Ash?
Well, like sure, I moved here to start my own life, my adult life. I'd already moved out of home to northern Queensland beforehand, and I found that I couldn't find work there because it was a really remote town and all of the jobs were naturally filled up already by the local residents. So when I moved down here, I had the aspiration of going to university, working on my bachelor's and going into, doing part-time work, getting up a bit of savings, just building myself a foundation. But I moved here, and then I don't think it was even a month later before we had lockdown and we had the crisis of people losing jobs. So naturally, I wasn't able to find a job then. I had sort of financially counted on that ability to find a job. Then once we did have, jobs starting to pop back up, I found I was definitely worse off there because my proper experience had been as a carer, and there wasn't really much going here then. And there was a lot of regulations now being applied as far as that I couldn't adhere to at that point. And when I moved here as well, I moved into a share accommodation, which I love living with other people, but it definitely brought its own complications with COVID as well. For example, we had to lock ourselves away when we had a COVID test, for example. I personally never had COVID, but just that period, those 3 days where you were waiting for a response, it was very isolating. You'd hear these people walking around constantly and laughter, but you couldn't engage in it personally. And I'd have to tell my roommates via text if I was to go cook myself something or go use the shower or anything. And it felt very much like a prison at the time. And even socially, sorry, it was a whole new dynamic for a lot of people. I'll admit I had the benefit of having a background in video gaming and streaming, so I already had a few connections online that I could re-engage with. But I know a lot of people around me didn't know how to, I guess, transfer onto those online communities. It was very intimidating, and I noticed there became a lot of risks associated with being online. We've all heard like the horror stories of the unpleasant people you may find online, and I don't know if it was just a personal experience, but I found there was definitely an increase of that risk when we had COVID. And a lot of my friends got into those unpleasant situations.
Yeah, so I guess you both touched on that feeling of isolation as well that young people might have experienced during this time and may still be ongoing experiencing because of, I mean, both of you have had that shared experience of moving to Adelaide during a time when building friendships and things like that can be quite difficult, and I'm sure that's been felt for other young people as well. In considering that, what do you think the current biggest challenge is for young people in the scope of COVID?
I think there's so many different factors to what kinds of challenges young people have faced, but I think personally, primarily for me, it was firstly coming out of that financial stress and recovering that money at a time. It was just so ironic because it's a time when you think you're building savings, like you said, and you're building a foundation and you're starting a different life to what you're used to before, and that didn't happen. I was trying to recover costs at the age of 18, 19, and that felt disheartening. So I think that was a big challenge at the time. And also for people that were new to Adelaide or they are in a new space, in a new city that they don't know anyone in, transferring to online socializing I'm not sure if everyone was comfortable doing that. I was still sort of in this mentality of waiting for things to go back to normal. I don't think I was accepting what I was getting. People were saying, oh, jump onto Zoom or jump on, and it felt really weird to be doing all of that. I guess I was just in a phase of denial. I think that was the biggest challenge, is I couldn't accept that this was just how it was going to be. We're all in a phase of acceptance now because we're using so many different online platforms that we'd never heard of before. But back then I just was like, no, everything's going to go back to normal. It might be a few months, but yeah. So I think it was just that phase of denial of not wanting to accept that it was going to be like this for we don't know how long. So just the unknown as well.
I guess we're talking about this webinar is set in, I guess, the context of South Australia because that's where we're all come from. Do you feel like that sense of acceptance is sitting with us because of the state we're in? And how do you think considering the unknown feelings that maybe some young people might be experiencing? What are your thoughts around some of that?
I know, even in the context of South Australia, I have a strong Indian background. So I connect with lots of international students that live here. I'm not an international student myself, but that community, I love being a part of all the festivals and everything that we celebrate together. So I got to know a lot of international students through that. And to see their struggles is something that I'm just starting to realize because my family is in Sydney and I haven't been able to see them over the last few months. And it's only been a few months now, but they haven't seen their families in nearly 2 years now. And that, to me, to see them, they don't always show it, but when they do, they really miss their families, and they really are disheartened and upset by the fact that they don't know when. And some of them are even willing to drop everything and go back. They have the potential to build such amazing careers here in South Australia and Australia, in the Australian workforce. But I mean, I was just saying before, how long can you go without your family? Some of them have old parents, old grandparents, especially in our Indian culture. Kids don't actually move out of the house until they're 25 or until they're married, and we lived with our families for a long time. And some of them came here thinking, oh, I'm going to keep going back and see my family and build a life in Australia. That was their dream. But they're now, because they just haven't seen their family, they're willing to leave that and go back and potentially not come back for a long time. So yeah. I think that's
It's a good point, Shrew. One of the questions that I had was, are there specific groups of young people that have probably been more affected than others? And I think international students in particular.
100%.
Stories that I've heard.
100%.
Yeah. Are there other groups of young people that you think have probably been impacted more than others in South Australia?
We were just saying, I think Ash was touching on rural area and regional Australia, within Australia. And she was talking about.
Oh, sorry to cut you off there. So naturally coming from a rural area, all of my friends and my family are rural people. For example, like my brother, he's 22 or 23. I should know that. He has found that because he can't go and socialize with his friends anymore, and he was a very social person, he's dug himself into work, and you can see the stress that it's putting on him now, being someone who was out doing all your normal 20-year-old things, going out with mates every night, joining clubs and whatnot, to just now having that basically a switch flicked. Okay, you now have to be an adult. You have to work all the time to keep yourself afloat. It is upsetting to see how it has been a very stressful event, but kudos to my brother for handling it well. And then other things like my friends living in a rural town, you have to travel to go to any sort of entertainment, and you can't now. You can't just go to the next city over. You can't just go see your friends and hang out, and your family events, which naturally in rural areas, family is a big part of it. You can't just go see them. You can't go hang out. Personally, it's been about 2 years since I've seen most of my family and my friends, and it's implemented a sense of guilt, and because I can't be there for their events, I can't be there when they're feeling upset. When I moved here, I relied on the ability to be able to just catch a plane back home or take a couple of days to drive there, and you can't now. And when you see something happening, like a friend getting married or going through a tough time, all you can do is send a text message, I hope you're okay. It makes you feel like you're not enough of a person for them.
Yeah, we definitely, I think when we were prepping for this session and talking about it, we talked a lot about the guilt associated with being in a state which is doing relatively okay in the scheme of things, touch lots of wood, but in the sense of then having friends or a family like you both touch on in other areas of the world or the States, and having that guilt associated with not really knowing sometimes how to support or how to be that friend or care for them. So thank you for sharing those quite real stories with us. Where do you think we then go to from here, or like what steps could people take as this pandemic is still floating around us and may still be for another year or two, or who knows how long in regards to that unknown cloud. As young people, what do you think can help young people yourselves, or what steps you and your friends could take?
I guess
I think, go.
You go ahead, Shrew.
I was just going to say, when we talk about young people, it's hard not to talk about social media. Social media, I think, has grown. The internet has grown so much just over the last 2 years, the use of it, or the fact that it's creating jobs with social media influencers, and maybe on one hand the pressure to look one way on social media and to look happy on social media and to look like you've got all the, and I'm guilty myself. I've had terrible days and I will still go onto Instagram and post a selfie of me smiling. And I think social media, it can be strenuous in some ways, but it also, I think, is a boon to our society if we use it the right way. There are platforms like Headspace that grow on Instagram, or other even social media influencers that personally advocate for mental health, that increased awareness of prioritizing yourself. And in a way, it's given us so much time to ourselves. I think I've learned so much about myself. When I won a beauty pageant for Miss India Australia, and in the interviews, people used to ask me, why did you go to Adelaide? What have you learned? And I think it really did teach me a lot about myself. And I think that's where we go from here, is recognize who we are, what we need, whether it's your sleep, your food, your health, exercising. We have 7 steps to, feeling better just by yourself. So I think in a way, if we take it in a way that focuses on us and our health and prioritizes ourselves, that probably we haven't done before, that's one way to go, I think.
Yeah.
Okay, so I want to touch on there with the social media. It's definitely a big stigma around social media and having to be happy on social media. I know, like, as soon as you see someone being vulnerable on social media, you'll get a bunch of people attacking them, like, you're only doing this for attention. And there's that whole idea that you can't be transparent on social media. You have to have this facade. And I know personally I've been bad for it as well, where you sort of start to implement that into your actual life, that idea that you have to keep being happy. There's no other choice. Otherwise, it's, I don't know, like, personally, sometimes I could feel like it's not legitimate. But especially with COVID, I guess, there's been the long term of not feeling so wonderful. And you start to question there, like, am I being a little bit dramatic with this? But the reality is, it's a tough situation. No one could prepare for this, and we're still learning how to mitigate the whole situation and still trying to figure out what normal is going to be afterwards. So I guess from here onwards, I think it would be best if we continue the advocacy for mental health awareness and, as Shru said, looking after ourselves, being aware of ourselves. Seeing a lot of companies working towards that as well is really great, but it's definitely something a lot of people, including myself, we all need to do on an individual basis as well.
Yeah.
I was going to ask, is there a balance here between staying informed as well as sometimes pulling yourself away from that overload of information that we can sometimes be faced with, that can sometimes be quite scary and just fuel uncertainty. That's what I worry about, is just the constant messaging around the pandemic and how that might impact people.
Definitely. Personally, I personally have anxiety and some other stuff, and I found watching the news every day, trying to keep in touch with what's going on, and constantly figuring out what I can and can't do, where I can and can't go, it just got too overwhelming. It was too much, and I didn't realize until I found the sense of dread every morning of, oh no, what's changed today? And I found personally I've had to take a step back from media resources that do speak about COVID. So I still check up what's going on, make sure I'm not breaking any laws or rules and staying safe, but I'm not going to watch the news every evening or read every article I see that mentions it. Yeah.
I feel like there is no sort of there's just no right or wrong answer to that. I feel like we may never be able to strike a balance, and that's just the way we need to know. There are times when we feel like if you feel like you need to pull away, I delete a few apps on my phone and I don't look at it. Or my mum in Sydney, the number of cases, they crossed 500 and then they crossed 1,000, and she said, I kept looking at the numbers every day until a point where I was like, this information is not helping me. So I need to know to then isolate that information from my life, because the cases just kept increasing and it made her more and more anxious. And she's a doctor. She goes to the hospital. She leaves my brother back home all by himself. And I think you have to make a choice of what information is going to help you and what you feel is not doing great for you. And then you leave that information and you decide that for yourself.
Yeah, fantastic.
I guess you have to be more direct with the information you do seek.
Is the other thing that I wonder, if we're talking about steps that young people can take, Is there a sort of view amongst young people around vaccination and whether that's a positive thing or whether that is scary?
I can easily say most of the people I've met are pro-vaccination, and for example, my partner, 21, he has a cardiac issue. He only just got out of surgery, open heart surgery, about 5 months ago. And these are the sort of people that I've noticed a lot of, in quotation, anti-vax people are saying, are the example that they're trying to pull up. But the actual reality of it here is he is seen as cardiologist, and to quote him, we're better off dealing with the side effects of whatever may come from the vaccine than you not surviving COVID. And naturally, he's going to go get his vaccine now that he is eligible and got that clearance too. And a lot of my friends who have their own variation of illnesses and myself, it's the same point of, okay, well, we don't know the long-term effects. We don't know yet. But we do know, however, that if we get COVID, it's not going to be a very good experience. It's not not something that we want to suffer without that vaccination.
Yeah.
Yeah, I think as a public health student, I impose my views quite often on friends and colleagues, and I try not to, because I have a very strong opinion on vaccinations, and the more I study epidemiology and public health, and the more I look at data, the more passionate I feel about it. But I guess, again, there it's just about maintaining that balance and respecting views of opposite sides. But I feel like I've seen vaccination rates, we've all seen vaccination rates go up, and especially in states like New South Wales and Victoria, where vaccination rates are crucial to reducing restrictions and going back to the workforce, and our unemployment rates and everything will come back to what it was before 2020 if vaccinations are increasing. Even the vaccine passports that might allow us to travel, it's all very exciting stuff. So I think vaccinations are crucial. But yeah, I have a very passionate view on it, so we might leave that.
I've noticed that, like, your view there, it's shared. I find most people our age are very passionate about vaccinations. And it's a case of, I've noticed that younger people, and this could, again, just be my own personal experience and the people I've personally met, are more likely to consider more than just themselves when it comes to vaccinations. So we don't just look at, well, I don't want the vaccine, I'm going to be fine if I get COVID. We look at, well, okay, I might be fine, but my grandmother isn't going to be if I give it to her. My ill cousin won't be. We look at the grand scheme of things rather than just a centralized view of it.
Yeah. I think all your opinions are likely shared by the wider community of young people too. Like, just alone that week that they released the age bracket where young people could receive the vaccine, and they not quite crashed the system, although I think they might have for a second. Yeah.
I looked at 2 a.m. To get a vaccine for that, and I was like, I'll just do it in the morning when I wake up. Yeah. And then it was another 2 months wait by 8 a.m. Yeah.
I think that's reflective of, especially in South Australia, the want of young people to get that vaccine. Yeah. That's great. Yeah. Great. We kind of quickly touched on it, but has there been any, just to finish up, I guess, a positive impact of COVID from your life? We kind of talk about it with a negative spin a lot of the time, and so I thought it was a nice way to end the session today to maybe talk about something that you've drawn from in regards to COVID. Now, we've talked a lot about resilience and the importance of gaining an awareness of validating your own emotions through that process. Is there anything you wanted to touch on to finish up the session?
Definitely there. I've noticed, and I think a lot of people have had the same benefit of this, is I've gained more of a social awareness through COVID. I found beforehand I could be very stuck in my own head and lack understanding for other people's situations. But the more that I read about issues and seen people around me have different experiences, I've gained more of a social view. And I guess not even just in relation to COVID, but other, social issues that are going on in Australia and worldwide, I've had more of a chance to actually look into them and gain awareness, understand what's going on in the world. Other than that, say like it's been a good chance to work on some self-improvement personally. I have built a bit more of a routine to take care of my own health rather than the beforehand where you just run and grab whatever you can to eat to take with you and don't always have time to go to the gym, don't have time to sort of self-reflect, but now there is that time.
That's great. Thank you for sharing that.
Yeah.
What about yourself, Shruti?
I was just thinking about a few different things, but I feel ironically, even though COVID has taught me so much about myself, I actually connected with people as we were coming out of the lockdown in Adelaide and socializing more and going out more. I actually think it gave us something to bond over. I don't know if that makes sense entirely, but when I now talk to people, we're more considerate and we're more willing to take in what someone else is saying. We're better at listening, I feel. I think we're better at respecting how the other person's feeling, because we know now that life could change and it could change tomorrow and something else could happen. And it was predicted far back that there could be an infectious disease that ends the world or changes the world and changes the way of what we think is normal. So I think now I've found that maybe, I don't know, I'm not sure if that's the same for everyone, but I think people are warmer and they're more welcoming and they're more willing to listen and take a minute for someone else. I think that's what it's taught me as well. Now that I can't go back to my family, I really feel like calling my mum every day, which I wasn't doing before, calling my brother every day. There was news of tremors of the earthquake in Victoria, New South Wales this morning. So the first thing I did was I rang my mum and I was like, "Are you okay in New South Wales?" I think we feel more for each other, and that's a good thing.
I definitely agree there. There is definitely a heightened sense of gratitude amongst everyone, and it's really nice to see, actually.
Yeah, we've all had this shared lived experience and we've all had different things taken away from it, but we all went through it. And so you're right, we can all connect that way.
We can all connect over that, even if I'm not related to you, even with so many friends that I'm not actually related. We're not related to each other, but we have this now to connect over, which is great.
Yeah.
Well, thank you for sharing your shared lived experience of the past year and a half that we've gone through with COVID-19. It's been great to, I guess, have this reflection and time together to chat about the impact it's had on young people and the continuing impact. I think it's something that we should continue to shine the light on and consider, and it's great that you've both had things take away from it in a positive way. Is there anything else you'd like to add, Steve, or any other questions?
No, just to thank you both for your time. Thank people who are watching online as well. Really appreciate both of your time today and for sharing your thoughts and experiences. It's been really insightful.
Well, thank you for having us.
Thank you. It was lovely.
Enjoy the rest of your days then, and thanks everyone for joining us online. It was a great session.
You too.